Hey guys, it's me, Dr. Reed. In this video, we're going to be continuing our discussion about the appendicular muscles, specifically focusing on, in this video, on the lower extremity. Now, just like the last video, you do not need to know all of this. There's going to be a lot of information. I'm going to be pulling notes from my past studies just to give you some drawing visuals. So do not worry. You don't need to know all the origins, insertions, all the specific little things, all the innervations. This will be an add-on, and especially if you go into grad school, you'll get more of this. This is an introduction. So focus on the things that I highlight. And in lab, it's really, do you know where in general, if you looked at a picture, where it is? And its general action. What does this compartment do? What does that compartment do? That kind of thing. All right. So looking at the lower extremity as a whole, so here we're seeing right here's the whole lower extremity. It is composed of our pelvic region. We're not going to go in depth with the pelvic floor muscles, as in we're not going to go through them at all. That will be something either lecture focused or when you're in a grad school like situation. We will be focusing on the gluteal region, the thigh region, both anterior and posterior and medial, the compartments of the leg, which is going to be anterior, lateral, and posterior compartments, and the foot. So, looking here at this anterior view, we can see we have the tensor fascia lata right here on the side. That's going to be lateral on the side, and that is connected to our IT band, our iliotibial band. A lot of people, this is just like a little clinical thing, a lot of athletes and people in general are like, oh, I have tight IT bands. So they roll their IT band over and over, and they're like, it's not getting better. Why is it not getting better? I have an issue. Well, the IT band is a band. It's just a ligament. It can't be stretched per se. The muscle it attaches to can though. So instead of focusing on that lateral side, come up a little bit more, come on that lateral hip and work on stretching and releasing the tensor fascia lata, the TFL, and you'll have way better luck at reducing that IT band pain. That's just a little clinical thing. So that's kind of up in the upper part. Then we have this muscle that starts right after the IT band. So here the tensor fascia lata, the TFL. Right next to that, this is the beginning of the sartorius. And the sartorius starts medially and it crosses it starts laterally and it crosses over to the medial side of the knee. So right here we see this. This is the sartorius. This is a common muscle that will be questioned, pointed out on imaging, things like that, sartorius. We also then have the four muscles that make up the quadriceps group, the quadriceps femoris, and that is vastus lateralis, rectus femoris, vastus medialis, and vastus intermedius. Vastus intermedius is actually underneath rectus femoris, so in this image we can't see it, but in this image rectus femoris has been cut. See how it's been cut? So now we're able to see vastus intermedius. So the quadriceps are made up of the vastuses plus rectus femoris. There are a couple of other interesting muscles we see here in the medial compartment. We have our adductors. So the medial inside of the leg, we have our adductors. Adduction is when the legs come closer to the midline, so bringing the legs in. So if I put my hands at my knees and I tried to push my hands together, so I took my hands and put them at the inside of my knees and I tried to push my hands together, that would be me activating my medial compartment, my adductors. Versus if I put my hands on the outside of my knees and I pushed them away, trying to spread them apart, that would be my abductors, which is what our glute medius does. So adductors are on the inside, on the medial side. So we have adductor longus, and then underneath adductor longus, we have adductor brevis, as well as our gracilis. Those are going to be muscles in that medial compartment. If we look at a posterior view, I skipped the leg. So in the leg on either side, you can see tibialis anterior. That's going to be the main muscle in that anterior compartment of the leg that I'm going to focus on is tib anterior. You can see that on either of those. There's not too much musculature on the anterior compartment, which you probably know if you've ever hit your shin on anything, right? It's pretty bony, pretty much just straight tibia. When we look at this posterior, here we see the glute max, right? That's the biggest, most superficial out of the gluteal muscles. Underneath the glute max, here you can see the glute max has been cut. We have glute medius. That's what's going to be doing abduction, abduction, moving the legs away from midline. Some of the other muscles that we see here is, here's glute medius. Underneath glute medius is the piriformis. Piriformis runs from here and across. The sciatic nerve runs underneath that, so a lot of people will have sciatic pain, and it's actually tightness in the piriformis. So if you stretch the piriformis, you're able to relieve that tension on the sciatic nerve, and then the sciatica will go away. That's another clinical kind of little thing. Besides that, as we're kind of looking here, we also have our hamstrings in our thigh. So our hamstrings is made up of our biceps femoris, semitendinosus, and semimembranosus. So those are the three muscles. The biceps femoris does have two heads, right? Biceps. There's a short head and a long head. Here we see, again, that medial has the adductors. In the posterior leg, we have our gastrocnemius and our soleus. So the soleus is underneath the gastroc. The gastroc plus the soleus makes up the triceps surae group. Gastroc plus soleus makes the triceps surae. It's called triceps because the gastroc has two heads and the soleus has one head. So together there's three of them. And surae means sural region. And remember, we learned that the sural region is that posterior or your calf region. So they make up your calf. Now, I don't have a good lateral right here, but the fibularis muscles are going, or also known as your peroneus muscles, are going to be on your lateral compartment. So those are the muscles on the lateral side or on your fibular side. That's why it's called fibularis. So let's focus starting with our gluteal. So we're going to kind of zoom in on that region. So on this is our superficial view. This is our deeper view. So superficially, here is the glute max, right? Big muscle. See how the fibers go kind of in this diagonal away and down. So that is how the fibers look for the glute max. Versus when we look at the glute medius, right here, glute medius muscles kind of go in this direction and it's underneath. It kind of has this pectate kind of look. And underneath this, if I took glute medius out, we would find glute minimus. We can't see that here because they haven't cut glute medius, but underneath that would be glute minimus. Here is that piriformis that I was talking about. So it starts here and it comes all the way across. This is where the sciatic nerve goes underneath it, and so this commonly can get really tight. So it's a deep muscle on the kind of intermedial side of the gluteal region. We also have our gemmelluses, a superior one and inferior one, and then in between the two is the obturator internus. And then there's quadratus femoris. So these are all muscles that make up the gluteal region. The only one you can't see here is glute minimus because it's underneath this. Now this is just looking at the posterior thigh, which we're going to look at in a second, but just so you can see, there's that gracilis, which is part of the medial compartment, adductor magnus, which is also the medial compartment, and then here are those three muscles that make up our hamstrings. We have semimembranosus, semitendinosus, and biceps femoris. So, again, don't worry about all of these origin insertions. This is just kind of see a drawing of it. So here you can see that glute max, glute med, and underneath that glute min, there's that piriformis. Here, that superior inferior gemellus with that obturator in the middle of them. So that's just kind of my little drawing looking at that. The rest of it, don't worry too much about. So let's talk about the thigh. So let's make the pokeball for our thigh. So our bone in the middle of our thigh is our femur. Remember that, femur. So remember that the thigh, another term for that, is our femoral region. And there are actually three compartments. So unlike the upper extremity where we had two compartments in both of our regions, we have three compartments in both of our regions. So on this one, this is going to be medial. This is going to be lateral. So I have my I guess we'll do posterior medial compartment and anterior compartment. So the actions that we see in each, in the anterior compartment, we have, you could think of it as flexion, but it's really specific of what flexion. So in our anterior compartment, we're going to be having hip flexion, and we're going to have knee extension. Right? And think about those movements that you do, because this is where our quads are. So think about when you're in the gym, what movements do you do to activate the quads, right? You're going to do a leg extension, right? As you do that, if someone says to like contract your quads, that's what you're going to do. You guys don't see me hitting my leg. You'll see this in lab. But, right, that's going to work. So that's that knee extension, but they also help with hip flexion, right? And your hip flexors are right in that front area. So anterior compartment does hip flexion and knee extension. The posterior compartment is where we have our hamstrings. Is going to do the opposite. So it does hip extension and knee flexion. And then our medial compartment is going to be doing adduction, adduction, bring the leg in. You could also say, because posterior compartment, in our glutes we do have, so like a little higher than that posterior compartment of the thigh. Technically, it's the gluteal region, so I don't count it in there. That's where that abduction of the hip is going to happen. So when we look here, and we already identified a lot of them before, but just so we can see, there's that TFL. That's going to be helping out with that abduction. Here we have sartorius, right, starting up here and coming down and along. Here we have rectus fem, vastus lateralis, vastus medialis, and then underneath that would be vastus. Underneath rec fem would be vastus intermedius. So our quadriceps are made up of those 4 muscles, quadriceps 4. Those are the main ones when we look here that I want you to focus on in that anterior compartment. In the medial compartment, the main ones I want you to focus on are adductors longus and brevis and our gracilis. When we're looking at the posterior leg, right, we have our 3 muscles that make up our hamstrings. That's important to know. Semitendinosus, semimembranosus. So the most medial one is semimembranosus, then it's semitendinosus, and then it's biceps femoris. So again, this is going to be a little like a lot of extra stuff, but here we're kind of just seeing when I look at the thigh region. So now in this Pokeball, I included the glutes in here because they help with some abduction. So that is there. Don't worry too much about including the glutes in that kind of sense. But when we look at the overview of the muscles, so you can see in this drawing of mine, I didn't talk too much about iliopsoas, but iliopsoas is going to be a pelvic muscle that does work into the anterior compartment. So iliopsoas starts here up on our lumbar vertebrae, and it comes over and it attaches to iliacus, which is on the inside of our iliac crest, and it comes in, and that's going to be one of those helpful hip flexors. So you can see that. It helps with that flexion at the hip. That's where a lot of people will end up getting really tight iliopsoases because they don't use their quads. They instead use their iliopsoas. So this is just kind of a drawing so you can see those different muscles. So medialis, lateralis, rec fem, and then underneath that rec fem would be intermedius. And there's that sartorius that comes up and around. Not too much for you to kind of focus on, but there's just a drawing visual in case seeing the cadaver photos is harder for you to visualize where those muscles are. The femoral triangle is something that's more lecture-based, but just to show you kind of how I have in here the contents that are inside the femoral triangle can be remembered with navel. The femoral triangle is created by our sartorius here, and then on the medial side, adductor longus. So that's kind of, and then on the top, we have our inguinal ligament. So that's going to create that triangle. On the posterior thigh, right here we had our glute, med, glute min, glute max was cut here. This is just me showing like the piriformis muscles, all of that, and then those 3 muscles. Now this drawing, I tried to do something a little more realistic, so it's a little harder just because I added a lot of the muscle fiber lines. But you can kind of see where we have semi-membranosus, semi-tendinosus, and then biceps femoris. Popliteus is on the back of the knee, and popliteus is what unlocks the knee. So that's an important muscle. I'll kind of talk about that in lab a little bit. So this is just looking at the popliteal fossa. That is more of a lecture idea. That's where we get a lot of knee things. And then here's just a little information talking about the origin insertion. Again, that's more lecture ideas, so no worries on that. All right, let's look at the leg. There are 3 compartments of the leg. So let's just continue with this side being lateral, this side being medial. So we have our tibia is medial, and our fibula is lateral. So we have a posterior compartment, an anterior compartment, and a lateral compartment. The anterior compartment is going to be responsible for, so kind of where our tib anterior is and anything like that. That is going to work with our plantar or our dorsiflexion. So dorsiflexion. Dorsiflexion is where I bring top of the foot towards my head or towards the front of my kneecap. Whereas the posterior compartment, which is our calves, is going to do plantar flexion. And that's going to be where I'm thinking about the bottom of my foot. Going towards the back of my leg. Or you can think of on toes, right? And that's how you, when you do calf raises, right, you come up on your toes, right? You're going into plantar flexion. My lateral compartment is going to be responsible. So in the lateral compartment, I'm going to have, I guess I should talk about some of the muscles. So in the anterior compartment, we have tib anterior is the big muscle that we see here. In the posterior, we have our calf muscles. Another name for our calf is our triceps surae, which is made up of gastroc and soleus. Gastroc is the abbreviation for gastrocnemius. The action of the lateral leg compartment is going to help stabilize you while you're running or walking. And the specific actions that it does is going to be eversion and plantar flexion. So it also helps a little bit with that plantar flexion that we see in the posterior compartment. I should do that in a different color. So I'll show you more when we get to my kind of other notes. But when we look here, so here's the front of the knee. Here we see that tibialis anterior. So that's going to be our big dorsiflexor. The fibularis longus and brevis, also known as our peronei muscles, those are going to be part of that lateral compartment. So that's doing eversion, where this is coming towards this. Inversion is the opposite, where it's going this way. These kind of say the name what they do, right? Extensor hallucis longus extends the big toe. But tib anterior is the main one that I want you to be able to identify here. Here we're looking at that lateral compartment. Here's that IT band coming down and in. Here's tib anterior. And then here we see those fibularis muscles of that lateral compartment. And then here's gastroc, and underneath gastroc is soleus. Here on the posterior, we see gastroc and its two heads, and underneath that, again, is soleus. Those two together make up triceps surae. So, this is me just reminding kind of where some of those insertions are. When I was doing these notes, there were a lot of bony markings that relate to muscle insertions, so I kind of drew that again. But looking here, so here I wrote all of the muscles, but really out of this, tib anterior is the main one I want you to remember for your anterior compartment. Gastroc and sartorius, not sartorius, soleus, that's a note mistake. That's to be soleus. Are the main ones in the posterior that I want you, and popliteus, which again unlocks the knee. And then the lateral, for that E version, your fibularis longus and fibularis brevis. So again, this is just a lot of information that you don't necessarily need to 100% remember unless it's lecture that you need to. But just tib anterior is the main one, the anterior compartment that I want you to know. For the lateral compartment, both fibularis longus and brevis. And then when we look at the posterior compartment, we have gastroc, soleus. They make up the triceps surae group. Gastroc is actually going to become, is attached to the Achilles tendon, right, the calcaneal tendon. So that's kind of its insertion is on the Achilles tendon. And then we also have popliteus, which unlocks the knee. So that's an important one that I like to focus on too, is because it helps to unlock the knee. So here you can see in my drawing, some of them just in a drawing, sometimes it's easier, right? So here's that tib anterior. I made this really thick leg. And here are those fibularis longus and brevis on the side. When we look in the back, we have soleus, and then on top of soleus, like if I were to put gastroc, it would be gastroc, so they would come down, all going into that Achilles tendon, or the calcaneus tendon. And then underneath, if I took all this off, we would see popliteus at the back of the knee, along with soleus. Now the foot, I'm not going to look at the cadaver for the feet. We'll look a little bit in lab, but this is kind of the overview of looking at, there are 4 layers that make up the different muscles of the feet. Don't worry too much. The main thing, again, just like with the hand, we have our interossi. We have, instead of calling them palmar here, we call them plantar. Plantar are for the feet. And then we still call them dorsal, and still the same thing. The plantar are going to be doing adduction, and the dorsal interossi are going to be doing abduction. Which here I kind of wrote out all of the different muscles, but here you can see that same idea of the adduction for plantar interossi and the abduction for dorsal pad and dab. And that is all she wrote. Now that's a lot of stuff. I know it is. Remember, you don't need to know everything. That's the big thing with anatomy. You will never know everything. I don't know everything. And I studied anatomy a whole lot. And I'm still studying it a whole lot. And people get things wrong. And it's okay. But this is a start. So focus on the things that I highlighted. In lab, we're going to go through it again. In lecture, you'll go through it again. And you'll study hard. And you'll do great. Hope you guys have a great time looking over this material. And I will see you in lab.